Well, it is 1 o'clock, so we will go ahead and get started. Again, welcome everyone to the OCC Informal Check-In with State and Territory Administrators on COVID-19 related issues. I'd like to welcome Shannon Christian to today's webinar. As you are all probably very familiar, Shannon is the Director of the Office of Child Care. Welcome, Shannon.
Thank you. So good morning or good afternoon, everyone. Really want to thank you for jumping on the phone on such quick notice. We have so much going on and we're getting a lot of questions that we can't always answer and don't feel close enough to the ground or what's going on. And so I really wanted this chance to have an informal discussion with you on some of the hot issues where your perspectives are very much needed. So for instance, I'm thinking about we have a lot of noise. Okay, I'll keep going. Some of the things we're thinking about is how well is the CARES money getting out? Are we meeting the child care need for essential workers? What's needed to help child care reopen successfully in phases, but with fewer children and following the practices that are in keeping with the CDC and other top guidance? How are needs varying by age of child and family configuration? And what do we know, if anything, about the new normal? Now, we have a lot of questions that we put a lot of questions into a polling format, but I know last time we ran out of time doing that and we didn't have enough time to talk. So this time we're going to rush through them a little bit more, and because I do want to have a chance to talk, but our team decided it would be better to at least give you an idea of what we're concerned about, let you answer really quickly, and then open it up. So I have been hearing a lot of really good things about what's going on in the state as well as some concerns. And so this is our chance to make sure that when we are asked to what we know or think about something, that your thoughts are included. So I think at this point, let's hop in and look at our first question. So how are the states using the CCDF CARES Act funds? And you can check any of these that apply. Interesting. Okay, let's go to the next one. Are people all muted so they can't tell me if we're going too fast? I don't know.
Hi, Shannon. The participants are muted, but they can utilize the chat box up in the left-hand corner of the screen and chat in any questions. They can absolutely, okay. Yes.
Okay, so you're already answering. I don't even need to read this, but for direct services and subsidies for specific children and families, how are you doing that? They're pretty good results on that. I think we can pop to the next one. Is it to the quality dollars to providers? How are you using those? Guys are fast. This is good. Okay, let's pop to the next one. Okay, is your state using the funds to support activities for? Oh, wow. Okay, let's go to the next one. This is one of my important ones. How well are the child care needs of emergency workers being met?
And Shannon, I believe this is one of the questions that folks will utilize the chat box in the center of their screen to enter in their answers.
Okay. This one's important because if more money gets mentioned, it's important to know whether or not it's all, mostly needed to help this emergency worker group, or is it time that we can start thinking about a little more future-oriented and trying to keep child care providers open until, in part at least, until they can open fully. We just trying to get a sense of where's the desperate need at this moment. Okay. Okay, we can go on to the next one. How well or quickly is the money getting out, and what are the barriers? Well, okay, let's go to the next one. Really about the SBA and what extent have the providers, been able to access that money, and do you have any way of knowing who's applied for that and whether they were successful? And then if there's any state barrier you think we can address? I'm trying to call them later, during next week, and I was going to use what you all told me as part of what I bring up with them. So I'm glad we're getting some responses. Okay, let's go on to the next one. Okay, do you have information on the extent to which child care staff, particularly family child care providers, have been able to access unemployment insurance? And if yes, what information do you have, and are there federal or state barriers to address, particularly for family child care providers? We heard that in some places the way that the forms are set up, they want people to provide information that doesn't make sense for this field. And so we have reached out to them through the Women's Bureau at Department of Labor, and they are willing to look at whether the flexibilities are enough or if they need to do some guidance, and so that we have a chance to do something about this one.
And Shannon, as folks are entering in information, just a little reminder that if someone would like to open up their phone lines, they can just raise their hand and they'll be able to unmute their line. And you can also give feedback verbally that way.
Right.
And for those of you participants who want to raise your hand, you can find a little icon of a person with their arm raised across the top black bar of your screen, and just click on that and it'll show your arm raised so that we can unmute you.
Okay, let's go on to the next one. Are we almost done? Given the range of available funding streams, are there ways that we can avoid duplication of payments and ensure that CCDF is invested strategically? This one may lend itself better to discussion, but if somebody's got it figured out, please type it in. Okay, let's go on to the next one. Oh no, people are typing. We'll leave it for a minute. Andrew, this is sort of your question. Do you want to clarify what you were hoping to get at with this? Is it a reporting question, or is it getting information from the other funding streams and putting it all together? What were you thinking about?
I guess we were wondering, so like when lead agencies are putting out the money, are they making any attempt to determine whether or not a provider has already accessed some other source of funding, asking them to provide an assurance that they're not duplicating payment that's already been made through another means or something of that nature?
So that makes sense. So just before we provide all the money by enrollment to pay for somebody's closed child care center so that they can stay afloat, do we know that the workers didn't go out and all apply for unemployment insurance and they're getting, unemployment plus $600 a week, while through another funding stream we're still paying for the full enrollment? We'll get to talk about this a little bit more next week when we have the discussion about data, but this is good for right now. Okay, next one. This one's another one that might be good for discussion, but if you have ideas, I think I'm going to give you a couple minutes right now to do this too. How are you planning to address the needs during the next phase as the economy and child care reopens, which could mean, are you thinking about doing sustainability grants with your quality dollars, or paying for more children that are attending in some way? Okay, last question. And again, while you all are writing, since this is the last question and we're about to open it up for discussion, and we did a really good job, we got through this in 20 minutes, so that gives us 40 minutes to talk. We can start talking now about if you're thinking about a new childcare model with fewer children, you know, what does that look like? What are you considering? And you can do the hands up to get called on. Okay, so right now, while you all are finishing that, I think I will change my mind and tell you that since we've got Andrew on here and Rachel, do you have questions, any questions about the guidance that went out?
So far, Shannon, we don't have any hands raised.
Okay.
So just a reminder, if anybody...
They're too busy writing. That's okay. It's nice to have a written record. So maybe I'm torn between just opening it up at random or kind of going back through the questions and having discussions on the topics. I think We'll try just opening it up. So I'll tell you what my first question is opening it up. Is that, do you have thoughts on whether it's easier to get money out through grants than through the CCDF direct services channels?
So Shannon, we've opened up a new chat box for everyone to continue typing in response to these questions that you're asking. And we'll continue to monitor for raised hands.
Okay, but I don't mind hearing from people. Why don't you just open up all the lines?
As Violetta prepares to open up the lines, just a reminder, if you're not speaking, to please go ahead and mute your phone. You can do so by pressing *6.
All guests have been muted. Mute off. All guests have been unmuted.
What's working and what's not working around getting money out right now? Like, is it easier to get money out as grants that help sustain the businesses, or is it easier to try to help people through funding enrollment? And then what do you do about people who aren't subsidized? I mean, have you been thinking about both parts of the market? And, you know, if you had your choice, how would you be helping? And we got a lot of the nitty-gritty answers, but I think we're really trying to think what can we do to really help people reopen, and or stay, you know, and knowing that they may not be fully open, and the fact that the whole market is a problem, not just the subsidized market. And we're, you know, there's a lot of talk among legislators and on the Hill, and, you know, people are wondering what's working and what's not. Is there enough money? Is more money needed? How has the money been used so far? So we collected some of that, but I think it would be good to just hear your opinions on some of these things.
This is Lisa in Louisiana. I'm not sure if you can hear me or not.
We can. Thank you for speaking up.
Hi.
Big gold star
Absolutely.
today.
No. Good deal. I need something at this point. So in Louisiana, both are easy. You know, we are in the process of issuing grants, which will go out next week. But we were fairly quickly able to turn from paying for attendance to enrollment, and that, you know, that is great for centers who had subsidy kids. But that varies from center to center and how many subsidy children they have. The grants we based on license capacity, and so that is, you know, whether it was private pay or subsidized pay, you know, it was based on their license capacity. We have 3 different licenses here in Louisiana, and so we're only able to give public funds to our Type 3 centers, which are majority of our centers. And we base it on license capacity because of the expenses that they have. I mean, the bigger the center, and the more children they have, the bigger the center they are.
So do you feel like that has gone pretty well?
Yes. We anticipate. They were very, you know, happy with that because we gave them a lot of flexibility on how they could spend the money because, you know, like the PPP, you know, was, you know, for payroll. So this they could use for other expenses, whether it was, you know, rent or, you know, extra, you know, supplies, for, PPE or sanitation or, things of that nature. If they want to pay their, they could use it for additional pay for staff and things of that nature. So we gave them a lot of flexibility in how they could use that money, which they needed.
That's really
and it
helpful.
gave them hope. I'm not.
Yeah, hope.
Gave
Well,
them
you
hope.
can't put a price tag on that. That's really important. Okay. What about others? Anyone have a different strategy or experience? How about questions for Don or Andrew on waivers or the guidance or whether or not you're getting what you need off of our COVID website where we've been posting Q&As to your questions? This is your chance to tell us what's going on.
Hi, this is Jude White from Tennessee, and so we have done, we've extended our practice of paying for the child slot versus attendance through the end of May, so that for children on subsidies and providers participating in subsidy, they continue to have at least that income stream even if they're closed or if the children aren't attending. But at the same time, we also announced a grants program for all providers, those on subsidy and those that aren't, to try to supplement lost income if they're closed and to supplement operating expenses if they had, 50% attendance or something like that, because they may be open but not have many families participating. And the goal, of course, is so that families aren't burdened with paying for care that they're not using. So we're supporting providers with both strategies. I don't know if that's helpful.
That is. It's all helpful. It's all helpful.
And I'll say, because I know I've seen some of the chat about the challenges of administering it, and we were just very fortunate in Tennessee that we had already established last fall sort of an enhancement grant program where agencies through Quality Dollars could apply for ways to enhance their program, improve compliance with licensing or expand capacity. And so we were just very fortunate that we already had a partner for grants distribution, and we were just able to dial up that partnership and do these emergency response and recovery grants.
That's really great. Okay. How many of you added in chat? Oh, go ahead, and then we'll see. I mean, did you have to staff up to do this?
No.
No?
We
That
have
was
been
a
working
sad no.
a lot.
Okay.
We've been working a lot. I do anticipate, and I'm sure everybody else does, the cost of childcare to increase, dramatically. So I think, we started our market rate survey. We stopped our market rate survey because we anticipate the cost of care just to be so different. And so I think, looking down the line, Shannon, to have more money to be able to pay our subsidy more would be extremely helpful, because I think it's outrageously expensive.
Okay.
For a number of reasons.
Okay.
If that helps.
It all helps. Honestly, really, this is what people are talking about, and it's really useful to know what you all think. I don't think childcare's ever had as much attention as it has right now, and at so many levels. So
it's definitely needed for our economy to work.
Do you feel like the business community understands that yet? Because one of the things we were thinking about doing is trying to reach out a little bit more and educate some of the business leaders and the decision makers who are thinking about opening the economy, trying to help them understand a little bit more about how this piece works so that they can think about it at the same time as they're thinking about reopening the economy in phases. can they think about how the child care is going to work? And I wondered, do you think that they need more information about how child care works?
I think they can always use it. I think in Louisiana we've been a little fortunate in that we've pushed early childhood hot and heavy probably for the last 4 to 5 years at least. And so a lot of legislators and everything, ran this past year on early childhood and the benefit of early childhood education. So, our governor's having a task force on reopening our economy, and early childhood is being brought to the table, which we're grateful for. But I think anything you guys could do from a federal level always helps.
Well, and I'm thinking about the school-age kids and the schools being closed and the older children, too, and that the parents, the little ones are the harder to deal with, but if you've got a 7-year-old and he's out of school already, you still have a child care problem. That's going to affect worker availability. So it has to be sort of a dual message. It's not just do they need it in order to be, school ready and ready for the future, but it's an important piece of getting the parents back to work.
Absolutely, exactly.
Yeah. Are others doing any messaging around any of this? Or trying to, how are you working at all closely with whoever is making the decisions about opening the economy? Do you feel like the policymakers are thinking about those two issues together?
I think so. In Louisiana, I think so. I think, we work closely with the governor's office and our Child Care Association of Louisiana and the Policy Institute of Louisiana. Policy Institute has done a couple of studies, and so yeah.
What about the other states that are on the call in any of these issues? What do you sense or see happening, and where are the gaps?
Well, this is David from Wisconsin. Oh, sorry, go ahead.
No, go ahead.
Oh, I was just going to say, I was just sort of typing that your comments about, communication and businesses understanding the childcare world and how it functions is extremely important. We do have a really good relationship through the governor's office and working with the legislature to get some of these funds quickly to the providers during the COVID crisis. But I think that messaging is going to be even more important as we face the possibility of having another episode with COVID in the fall, and how this could all turn back around very quickly.
I used to live in Wisconsin, and I miss it, and one of the things I miss the most is that farmers market at the Capitol. Is that all closed up?
Oh, yes, that's all closed up now, yeah.
Sad. Okay.
Yeah. I guess my big concern is I hope businesses don't think when it reopens that it's over, that we could have to ramp things up quickly again at some point.
Right. Well, that's part of why we're trying to learn as much as we can about how to support the child care and the emergency workers, and then the reopening and all those pieces. What can we learn from all of this and your experiences this time so we're better positioned next time? So, all the information that you have, all of you, is really important. So when Dave spoke, someone else was wanting to speak too. It's your turn.
So hi, this is Jude White from Tennessee again. I was just going to say our governor's formed sort of a task force called the Economic Recovery Group, and they have been very interested in what we're doing in the child care space, and we've just been working on some guidance for providers seeking to reopen. And that governor's group has been, the governor's group has been very involved in that. They want to promote that information. So we're hand in hand there, and from our perspective, we really feel like it's just the child care industry is just going to be unstable for quite a while, because you can't know what your attendance numbers are going to be. That you've got staggered reopening of businesses. We have launched both essential employee child care payment assistance specifically for those using licensed care, but then we've also launched a network of temporary care locations managed through our YMCAs and Boys and Girls Clubs, really focused on the school-age children. So both of those programs run through early to mid-June, and so we will be, as those, particularly as the temporary care locations wrap up, we really will be promoting the reopening of the traditional child care location, but we're thinking about how do we help them kind of stabilize their revenue streams for at least a little bit. Don't know what that looks like or if we can even do it, but how do we help them find some stability while the workforce situation stabilizes? So those are just some of the things we're trying to think about.
That's great. Do some of you hear about or wonder about, are parents going to be too scared to come back to a group setting? Are they going to look for something else? I mean, are they anxious to get back in there,
Yes.
or are they wary?
They're very wary. Even with our emergency child care applications, we had a significant number that decided against it because they're scared.
So that's good to know. What did they do instead? Do you have any idea?
I think they either are keeping their kids at home or trying to find, other family homes, that are not regulated probably. And we have had a few more family homes that have become certified, but, I think that's what they're doing.
Okay. Do you feel like
this is Denise in Oklahoma.
Okay, go ahead, Denise.
I was going to say, this is Denise in Oklahoma, and we have put a lot of our CARES Act funds into what we're calling the kith and kin care, to where children can be, additional children, expanding the care inside the child's own home due to the concerns of, parents and families not wanting to put their children back into those group child care settings. So we've invested quite a bit of our funds into that.
So would those be existing kith and kin providers that just expanded to take on more children? So these might have not been their kith and kin.
No.
They were other people's kith and kin, but they took them in? I mean...
No, these are expanding for new kith and kin care.
New ones, okay. All right.
Because previously before, it was the program was used very limited in Oklahoma. So we're expanding this as far as the background investigations and things like that to kind of help out during this time, so more children can receive care in their own home or the home of a relative.
Yeah, I think that's really important to kind of make sure that all the different options are being supported, especially if we're not sure what parent preferences are going to be. So do others have experiences about how they're working with the family child care and more informal care settings that they can share? What do you most want us to know about what your experience is right now? Like if you weren't kind of all at a distance on the phone way far away and you had us sitting here listening, what would you tell us? Y'all aren't usually so quiet. You can repeat stuff you put in the chat because I haven't had a chance to read it yet.
Well, this is David again from Wisconsin. So I guess I would I would say I appreciate the frequently asked questions and the updates. They're very timely and informative. I also appreciate the language that ACF used when they added the money to our discretionary fund, which allows us to sort of treat it similar to our shares funding, just with less restrictions. That has helped us on the back end with making decisions, whether things are grants versus payments, et cetera. So just wanted to let you know that we appreciate that.
Good, that's good to know. Are you having trouble finding the supplies? I mean, we know you can pay for them with this money, but is it hard to get what you need?
Yeah, this is Christy.
Yeah.
And this is Christy. I can tell you we definitely are too. Sorry. Good.
Yeah, PPE is extremely hard to find.
Okay.
This is Christy again. I would just say if there's any, I know some states already had relationships built where they were able to make bulk purchases with vendors, but if there are vendors out there willing to work with states, like that would be really helpful for us to have some resources for supplies.
Okay, we'll ask around about
this
that.
is like Oregon turned me on to a company called MMCAP, and it just so happens that our state had a state contract with them, and within them, there's a bunch of vendors under them. I'll put it in the chat box.
Yeah. Okay. Yeah, that's a really helpful tip. Does my team have questions? Okay, I have another one. How important is more admin support, more money that you can spend for hiring or doing the work if there's more money? Like how has it been handled getting this 3.5 billion out and you know, can you do more without hiring a lot of people, or do you need the people along with money? Like what parts are the most expensive?
Right, so this is David from Wisconsin again. I would say that's absolutely critical. None of the system changes, and we're developing system processes to get the money out. That's not cheap, and we need to have resources and IT staff brought on board to help with that. So any increase in the amount we can allocate to administrative costs would be greatly appreciated.
And then how quick does it I mean, how quick can you get this stuff on board? Like, we've been promised some share of the money that we gave to you, just a little bit for federal, and we haven't been able to even use it yet, you know, and if we were going to bring on people to help us, we needed them the last month. So I just wondered if it's the same for you, or do you have speedy procurement paths in emergencies?
Yeah, we have, like, especially around hiring resources. We can quickly bring on IT resources. The problem is there's always a learning curve for them, so that's difficult.
Right. Do others have thoughts on these procurements and other things that have to do with getting money spent on different things that are important right now? Or is it mostly that it's the legislature wanting to get involved, or some process, regulatory process that you've got to deal with before you can move when things are slow? If this were a cocktail party, it would be so dull because nobody's talking to each other. Here you all are, 50 of the most important people in the world, right here on the phone with us, and you wrote a whole bunch, and I'm super grateful for that, but nobody's talking.
I felt bad.
Can you hear me?
The phone.
Hello? Hello?
Hi, this is Cindy. I've been having I had to dial in. I was having a hard time with my computer. So I'm from Minnesota, and I've been trying to chime in here over the text. But I think to your question about the hiring, we wouldn't necessarily, we're on a hiring freeze, so that wouldn't be an issue for us. I think the issue is that, for Minnesota, we received a little over 48 million, and the flexibility is really helpful, although it also adds to the challenge of what to prioritize. And so we are working very closely with the governor's office and the children's cabinet in many different pathways and scenarios and how to figure out what our priorities are, because there's so many priorities here, very similar to all of you all. And so we've had multiple conversations and strategizing with our partners from Department of Education, and then also looking to our partners at DEED on those efforts too, but more so very closely with our education, looking at not just our current situation right now during the school year and serving children of essential kids, but also looking into summer. And so I had mentioned in one of the questions that although we have not made concrete decisions on the CARES funds yet, our legislature did allocate $30 million of a state appropriation for us to start a peacetime emergency child care grant. And so that's a stand-up program utilizing our child care awareness coordinating office system to help us launch. Our governor signed the bill on March 28th, and by April 1st, we were able to launch the first round of application. And so that $30 million will go over 3 months. We just wrapped up our first round, so over 3 months, so up to just shy of $10 million, because there's a little bit of admin cost there. But what we found is that through our increased data analysis during pandemic, we anticipated roughly around maybe 1,200, so being able to serve around 1,000. And so we received over 5,400 applications coming in. And our focus really is only family child care and child care centers, although Minnesota has a couple of other provider types here that we did not include as the first round here. So as you can see, and then we were able to award about 1,200 providers, with more than half of those go to family child care versus centers. And so there's a huge need here. And those are some of the pressure points that we're continuing to analyze here as part of the CARES Act funds, and how to best respond to provider needs and family needs. So sorry for that long-winded. That's a summary of all the things that I was trying to put in here.
No, that's great. That's really helpful to hear. It's good to have the numbers and see that, how far you were able to go against what people had asked for. Very helpful. Thanks, Cindy.
And I did include a link in one of my responses here, the landing page that we created specifically for COVID, for families and providers, and that's the landing page that we plan to continue to have updates about these issues that I'm talking about. So thank you.
That's great. Thank you. I heard a few others. Yeah. Okay, go ahead. Lisa, did you say?
A couple of things. Yes. Okay. A couple of things if for your consideration, just because I think, us along with every other state is just trying to figure out where is this going to land in our state. And, if you guys could consider, I think it's our year for our payment error rate, work. And, we are so swamped with all of the, other work that has been added onto our plate, extra staff and all that good stuff. That would be greatly appreciated. And it may be a little too far to think about the state plan, but the state plan's coming soon. Do we want to, extend more time to do the market rate survey to see, where we are with that piece as well, and therefore push back the state plan a little bit? It's just some thoughts to, kind of put it out there. I think our biggest concern is trying to keep the child care industry afloat right now in order to keep the economy, or to help the economy. It is, it's scary with the unemployment. And then also we're looking at, we didn't have a finding work eligibility criteria, so we're going to be adding that on. Unemployment be so high, that's something that we're going to look at as well. So we anticipate, having a lot, more folks, eligible for that, and therefore any funding that could come that way would be beneficial.
Okay. So we don't control the funding, but sometimes we get to weigh in on it a little bit on what's needed and more than, some of the same discussions you're having. So it really helps us to know what you're going through. Anyone else? Anything from our team?
Hi, this is Andrew Williams from the Federal Office of Child Care, and just wanted to mention in the guidance, the information memorandum that we issued on the CARES Act funding, we indicated that additional guidance would be coming in the future on data reporting requirements. And so we wanted to talk with you all first about that. We know guidance is needed as soon as possible, but would like to touch base with you first. So we're scheduling a webinar for next Friday, May 8th at 1 p.m. To have a discussion with you about data reporting requirements for the CARES Act to get your input on what is feasible. So if you could please mark your calendar and watch your email boxes for the invite.
And just to clarify, is that 1 p.m. Central Time or Eastern Time?
Sorry, it's 1 p.m. Eastern Time.
So let's end on a note of some really big success. I'll tell you from our end, what we're, bragging about a few things just because it was so hard for us to get the money out. You can identify with that because you're struggling with that as well. But we managed to add to childcare.gov a section that talks about how families can find child care if they're emergency workers, and we put a state-by-state guide in there that talks about the state links, any hotlines, and then any R&R activity that's really meant to help the emergency workers link up with care, either in real time or with just personal assistance going through and finding that care. And so I wanted to alert you to that being there. And there are a couple of other things we've put on there, like the CDC guidance and a few extra pieces. But it wouldn't seem like such a big deal to make a change in our website, but we hadn't been able to get in there to do anything really substantive for a long time because nobody knew how it worked. So we didn't have it was like some kind of outdated or different kind of software package that nobody knew how to operate anymore. So for us, that was a really big victory to be able to help everybody about that. And we're going to do a rollout that talks not only about the pieces that are in there for helping this new little COVID-19 help emergency workers find care, but try to push the whole childcare.gov site in its full capacities, which are mostly about linking to your website and helping people link up with child care and understand how to find good child care. And as we move further on that, I think we might want to talk more with you about if we can use that tool and the links to you in some way to get some of this information out to people more quickly as the landscape is changing. So we can talk about that another time, but we were really happy to be able to get into that system again and be able to really use it and update it and change it. And so we're looking forward to making it even more useful. So do any of you have a victory to share and end on a high note?
This is David. I'll chime in real quick. And
okay.
I don't know, maybe I shouldn't say this, but this whole crisis has really forced us to work so much closer with the R&Rs and other key stakeholders and advocates across the state to communicate consistently with each other and with the families, providers. So not that we didn't work together before, but I think this has really pushed us to being that one big team versus us and them as contracts.
I love that. I love that. Thank you for sharing, David. And thank you all. I mean, I'm looking forward to having this nice dialogue to read over the weekend and learn everything that you all talked about. And again, thank you for jumping on the phone with no notice. It means a lot to us to have your willingness to participate in some of that. And know that we're here for you and we're doing whatever we can. And if you have some kind of special need for TA or something that you think would help yourself and others, make sure you let us know, because we want to be there for you. And we do have, we can rearrange what we do so that we meet new needs and maybe shift our attention from something to something else. So please know we're here for you, and have a really good weekend and stay safe. And thank you. Bye, everyone.